All right. Hello, everyone. Thank you for joining us for Colorectal Cancer Screening Saves Lives. I am Becky with the Howard County Library, and today we are partnering with the Howard County Health Department to bring you the first installment of our colorectal cancer awareness webinar series. So today we are talking about colorectal cancer screenings. So people can have colorectal cancer without having any symptoms. Colorectal cancer may be prevented through recommended screenings, early detection, and treatment. Join in to learn how to reduce the risk of colorectal cancer through dietary changes and physical activities. And again, this is just the first of our 4-part series. So after today, be sure to check out next week. We're going to be talking about how smoking and vaping affects colorectal health. And also in March, we're going to have one on the 23rd and the 30th. So registration for that can be found on the Howard County Library's website under our events and classes tab. All right, and with that, I will turn it over to our presenters if they want to introduce themselves.
Hello, my name is Jeong from Howard County Health Department. I work for Howard County Health Department for 9 years to serve the public by educating, advocating, and navigating individuals through the breast, cervical, and colorectal cancer screening services. Nice to see you.
Hi, I'm Natalie Hall, also with the Howard County Health Department. I'm a community health educator. I've been with the health department for 4 years and just bringing important health topics to the community and spreading the word about the CARET project.
All right, so today we're going to take a look at what is colorectal cancer, the statistics, risk factors, symptoms, the different types of screenings, and Maryland's no-cost colorectal cancer program.
Thank you, Becky. Thank you very much for joining and inviting me to this series today to discuss such an important topic. As Becky says, the objectives of today are what is colorectal cancer, statistics for Maryland and Howard County, the risk factors of colorectal cancer, and symptoms that should make you concerned, different options of colorectal cancer screenings. And finally, I would like to introduce the Maryland Colorectal Cancer Program. And as a quick colorectal cancer review, it is the cancer that begins in the colon or rectum. Colorectal cancer starts as a precancerous growth called a polyp that can become cancerous over time. However, not all polyps are cancerous. To prevent and diagnose colorectal cancer, providers use different types of screenings. The colon is also known as the large intestine, which is about 5 feet long, and it is the part of the digestive system that absorbs water and minerals. The colon also eliminates body waste. Here is the simple picture for you. The colon or large intestine outlines the small intestine. And you can see here, right lower corner, there's a small image to show you what a polyp looks like inside the colon. There's a small polyp there. And Natalie?
Thank you, John. Let me go ahead and share my video. There I am. Thank you. So why are we discussing colorectal cancer today? Well, it all goes back to the data. So colorectal cancer is the second leading cause of cancer deaths in the United States. And as the image on the right shows, it affects more men than women. So we're looking at the death rate in the United States by race, ethnicity, and sex. So colorectal cancer disproportionately affects the Black community, and the rates of colorectal cancer are higher in Blacks than any racial ethnic group in the United States. According to the American Cancer Society, African Americans are about 20% more likely to get colorectal cancer and 40% more likely to die from it than most other groups. As the health department, this is the type of data that tells us we need to find ways to increase health equity. So presentations like this, partnerships with community organizations, and investing in colorectal cancer screening programs are just some of the ways that the Howard County Health Department has decided to address this need. So what do Maryland statistics look like? So surprisingly, the pandemic has not completely disrupted the number of Marylanders receiving colorectal cancer screenings. Data shows that 76.6% of Maryland adults 50 to 75 years old reported receiving at least one of the colorectal screenings in 2020. So this is higher than the rates for the United States. It's important to note that in 2021, it was estimated that 2,550 new cases of colorectal cancer would be diagnosed. And almost half of those diagnosed with colorectal cancer would die from colorectal cancer. So how does Howard County look? So 54% of adults ages 50 to 75 had a colonoscopy or a colorectal cancer screening within the past 5 years. And that was reported in 2021. However, there has been an increase in the number of residents that reported that they've never had a colorectal cancer screening. And these are the individuals that we need to learn more about. Where do they live? Where in the county are they? And what are the barriers that they're having? And how do we break those barriers? So in 2021, 26% of Howard County residents skipped or postponed their routine colorectal cancer screenings due to being just afraid that they would be exposed to COVID-19. So now is your opportunity to reschedule those appointments. So, and I'm not just talking about colorectal cancer screening appointments. I'm talking about all of the routine appointments that we have pushed off due to just COVID-19. It's just took over and it became, we were calling our doctors saying, let's push it back, let's push it back. Well, now's the time to call your physicians and get those routine physicals, mammograms, and colorectal cancer screenings rescheduled. So what are some of the risk factors? Well, there's two different categories of risk factors, one of them being behavioral. So these are the things that we can control, that we can change. So physical inactivity, being overweight, which really, if you think about it, go hand in hand. As soon as we start decreasing our activity levels, our weight starts creeping up. This is important because our body needs us at a healthy weight so that our organs can function properly. Another risk factor is smoking and vaping. Tobacco products in general have been linked to so many different diseases and illnesses, and colorectal cancer is one of them. There's different chemicals that change the cells in your body, and also they make it difficult for your body to fight cancer. Vaping is no different. It's also dangerous. The chemicals produced in vaping contain harmful and potentially cancerous poisons as well. And then there's alcohol. So it's very interesting to me that we seem to disconnect when it comes to alcohol and how it affects our bodies. So those who have an average of 2 to 4 alcoholic drinks per day have a 23% higher risk of colorectal cancer than those who have less than 1 drink per day. So I'm gonna repeat that. A person who has an average of 2 to 4 alcoholic drinks per day has a 23% higher risk of colorectal cancer. So if you're someone who comes home and you have a drink when you come home through the door, that's 1. And perhaps you have another one at dinner. Well, if you do that every night, you've now increased your risk of colorectal cancer by 23%. So just something to keep in mind. So something that I briefly discussed was smoking and vaping. So as I had mentioned, the chemicals in cigarette smoke can weaken the body's immune system. So it also makes it difficult for your body to destroy cancer cells. So this is something to think about even if you're not a smoker. So if you are around someone who is using a tobacco product, you are also at risk. So just keep that in mind, that even things that you're not doing, but others are, they're also affecting your health. Next slide, please. Other risk factors are related to heredity. So these are things that we aren't really able to change. Things like personal or family history of polyps, colorectal cancer, or other types of cancers. Our age. Unfortunately, we can't change that, right? So this was something that actually the recommendation has recently changed. So in May of 2021, it was recommended that people receive colorectal cancer screenings starting at age 45 instead of 50. And we'll discuss that a little bit more. So we briefly discussed African Americans' risk and how colorectal cancer is affecting them more than other populations. And also the Jewish and Eastern European descent increases your risk of colorectal cancer. Inflammatory bowel diseases, these are things like Crohn's, genetic syndromes, and even diabetes. So let's look even a little deeper at African Americans and colorectal cancer. So compared to Caucasians, African Americans develop colon cancer at a younger age. They have decreased access to screenings. They have more aggressive colon cancer. They have a reduced survival rate. And they actually don't respond to chemotherapy when it's as well as others when it's in advanced stages. So when we are looking at these bullet points, it's like, okay, what can we address? What can we change here? And it's just staring me, in the face. Decreased access to screenings. Why? Why do African Americans not have access to the screenings that are well known? So that's where we start. That's what we need to do. We need to get the screenings out into the community. We need to educate and share what we know about colorectal cancer and what screenings exist and the accessibility to those screenings. And that will really help us decrease the number of people getting colorectal cancer at a younger age, or even how aggressive it is. Because if you can catch colorectal cancer early, then it doesn't have a chance to become aggressive. So what are some of the symptoms? So some of the symptoms for colorectal cancer, honestly, it's kind of a trick question because you could have no symptoms at all. You could have minor symptoms, or you could have multiple symptoms. So there really is a broad spectrum of what symptoms look like for colorectal cancer. So some of those symptoms are rectal bleeding, dark stool or blood in or on stools, a change in bowel movements, maybe it's narrow stool or constipation or diarrhea, and persistent persistent abdominal pain, gas, indigestion, and cramps. And then some of the other symptoms include unexplained weight loss, a loss of appetite, nausea, vomiting, chronic fatigue, iron deficiency, anemia, not due to other conditions. So I just want to go back, and when you're looking at all of these different symptoms, you really could chalk them up to other problems, right? So, I mean, perhaps I'm not eating as healthy as I should. Well, then that could explain why my stomach hurts. Or maybe you're not eating as much as you were, so you're losing weight. Or perhaps you're just super busy and exhausted all the time. And we just chalk that up to, I have a busy life. So these are things that we really should be taking more seriously. We need to listen to our bodies. And when we're starting to have some of these symptoms, we need to get in contact with our physicians. And quite honestly, because you could have no symptoms at all, it's important to remember that you do not know if you have colorectal cancer unless you have a screening.
Thank you, Natalie.
Thank you, Jeong.
Now, why don't we talk about colorectal cancer screening options? So there are two groups of colorectal cancer screenings: invasive and non-invasive. The first screening option within invasive screenings is colonoscopy, which is known as the gold standard screening. This is an endoscopic exam to find changes or abnormalities in the large intestine and rectum. Colonoscopy is considered the gold standard because providers are able to remove hyperplastic or suspicious polyps during the procedure, which is not done during any other screening. Another screening option is double contrast barium enema. This is the type of contrast radiography. The providers use X-rays and the contrast agent containing barium. And third option is the flexible sigmoidoscopy. This is a specialized endoscopy that allows the provider to examine only the lower part of the colon and rectum. And finally, the virtual colonoscopy, which is a little bit expensive, but is valuable method. This is the CT or MRI guided colonoscopy. And the second group of colorectal cancer screenings are non-invasive. Fecal immunochemical test, or we say FIT test, is a diagnostic method for colorectal cancer screening. These tests look for a hidden blood in the stool. And the last, fecal occult blood test, or FOBT test, and Cologuard is a lab test to check again for hidden blood. This test could be done in primary physician's office. And there are several questions for you to consider before you schedule a colonoscopy. For example, does my insurance cover colorectal cancer screening? How do I choose a gastroenterologist? Do I need a referral for colonoscopy? How much is my deductible or copay? And you will also want to collect information about your family medical history, or make a list of your current medications. Let the provider know your preferred language or primary language. And you can ask your doctor how often to get screened. Your provider will let you know when you need to schedule your next colonoscopy after the procedure. Now, I really want to introduce Maryland's no-cost colorectal cancer screening program. The goal of Maryland colorectal cancer screening program is to increase the public access to healthcare especially for those who meet the eligibility criteria. For example, proof of Maryland residency and financial eligibility. And the goal is to prevent and early detect or early diagnosis colorectal cancer, and to increase timely follow-up and treatment, and to decrease health disparity and death rate. Maryland Colorectal Cancer Program eligibility criteria. Basically, all Marylanders are eligible as long as they can meet the criteria. For example, all Maryland residents, they have to provide a proof of residency, such as Maryland ID, and their age 45 and older with average risk. Individuals 18 years and older with increased risk with symptoms. Marylanders who are uninsured, underinsured, or insured for navigation services. And they are in the limited income criteria, 250% of federal poverty guideline. This detailed information, once you reach out to the health department, we will guide you. And Maryland Colorectal Cancer Program provide fundings for pre-screening consultation and screening colonoscopy, biopsy and laboratory charges, surgical consultation if needed, case management for every patient, patient navigation services for insured clients. And one of the biggest is we provide interpreters. For example, language line or in-person interpreter or translator.
Thanks, Jeong.
You're welcome.
So Jeong went over the Maryland Colorectal Cancer Program, and I just wanted to discuss CARE-app and some of the other programs that exist. So CARE-app is a free resource where you can go and find resources for food, housing, health, and resources for topics that we've discussed today. So specifically, what exists for colorectal cancer screenings. So we also discussed tobacco, and we have resources listed for cessation. So all of these and more, definitely more, resources can be found at findhcresources.org. So all you do is go to the website, put in your zip code, click search, and then you can browse through the directory and find the resource that you're looking for. So you can reach out to the Maryland Colorectal Cancer Prevention Program by contacting the Howard County Health Department. We're always happy to help you connect with for screenings. You can contact us at 410-313-4255. And also the link provided is a favorites folder. So this is a folder that has a list of resources that you can find in CARE-app, all connected to colorectal cancer. And then our smoking cessation programs. So again, within the Howard County Health Department, we do have tobacco, vaping, prevention, cessation, and information. Those services could be contacted at 410-313-4255. And the Maryland Quit line is another great resource. So you can go to 1-800-QUIT. It's a free phone line. You can give them a call. You can also visit the website. And then I also have listed resources for quitting, again, that you can find within CARE-app. So as it was mentioned at the beginning of our presentation, this is just part of a series. So we do have 3 upcoming webinars. On March 16th, we'll be discussing how smoking and vaping affects colorectal cancer. On the 23rd, you'll hear from a nutritionist with Giant Food about eating to prevent colorectal cancer. And on the 30th, you'll learn more from the Office of Aging Independence on immunity boost of exercise. You can register for those webinars by using the link that's available. And I'd also like to ask that you take a brief moment and complete our survey, just letting us know what you thought about the information, how we can get the information out, and how we can provide more information about other health topics. And here we have just our contact information. If you do have any questions, feel free to contact Jeong or myself. And I just want to say thank you for being here, listening to what we have to say, and hopefully sharing this information with your friends, your family, and really spreading the word so that we can decrease the number of people affected by colorectal cancer.